I think in the last few years it's become obvious based on a number of publications that at-home blood glucose monitoring both in cats and dogs is beneficial. In the past we used to think it probably didn't shed any valuable clinical information that would change how we treat the patients, but now based on studies out of the US, out of Europe, and out of Australia, it's pretty clear that having that kind of data is very important. One of the things that it does is it eliminates the variability that's inherent when animals come into the clinic. Bringing the dog or cat into the clinic artificially raises their blood sugar levels because of stress. And so if we can eliminate that, we get a much more accurate picture of what's happening at home. We also know that day-to-day variation in blood glucose curves obtained in the clinic setting can also occur at the home setting. So the more information that we can get about what's happening in that owner's home, the routine, the daily feedings, the insulin injections, that truly mirrors what's actually going on inside of the patient. Also, some of the newer intensive insulin protocols, especially in cats, where we're trying not just to control the diabetes, but we're trying to get the diabetes to go into remission, almost requires the use of at-home blood glucose monitoring. Because in order to really determine what that cat's blood sugar is, we need to know what it is at home, because the owner is going to be making dosage adjustments based on those measurements. Some owners are definitely reticent to think about doing at-home monitoring. They're afraid they can't get the glucose, they can't get the blood sample, they don't know how to use the glucometer. But it's actually pretty simple to train an owner how to use the machine, how to transmit that data to their veterinarian, and then where to get blood samples. Many good videos are available. The folks that make AlphaTrack, the Abbott folks, have a nice video not only on how to use the glucometer, but where to get blood samples. And I think once we can convince them of that, they're much more comfortable with the idea. We also emphasize to them it may be a less expensive route, because if they can monitor the glucoses at home, and especially in a cat, if we can get the diabetes to go into remission, it's far cheaper to do an intensive protocol up front, including at-home monitoring, than it is to bear the expense of treating a diabetic cat for years. So I think once they understand the financial aspects and understand that we're really trying to get their cat to go into remission, it's much easier to convince them that they can do it.